to Navigating Ethical Waters, a comprehensive approach to nursing ethics, where we dive deep into the real-world application of the 2025 Nursing Code of Ethics. I'm Jodi O'Malley, whistleblower and founder of Righteous RN. In this course, we'll explore what it truly means to practice with courage, integrity, and moral clarity in today's healthcare landscape.
First, let's talk about institutional versus individual ethics. Provision 5.3, integrity. Hospitals implemented strict policies that didn't always align with what we knew as evidence-based care, or even with what patients wanted for themselves. Nurses were stuck between doing what they knew was right and following institutional rules. A constant tug-of-war between personal integrity and professional expectations. For example, I witnessed situations where nurses recognized that alternative COVID-19 treatments had shown promise, but were told they couldn't even mention them to patients. It wasn't because these treatments were dangerous. It was simply because they weren't part of the hospital's protocol. This forced nurses into an impossible dilemma. Should they stay silent to protect their job or speak up? Let's shift to one of the most pressing ethical concerns that surfaced during the pandemic: autonomy and informed consent. Provision 1.4 affirms that the patient's right to self-determination, the right to make informed decisions about their care, including risk, benefits, and alternatives. Provision 2.1 reinforces that our primary commitment is to the patient, not policies, protocol, or public opinion. But during COVID, this became incredibly challenging. Patients weren't always told about repurposed medications that showed promise. Many felt coerced into accepting treatments with no discussion of alternatives. Nurses who raised concerns were often told to stay silent or risk losing their job. Justice and patient rights, and how it connects directly to the 2025 Code of Ethics. Provision 8.1, the collaboration imperative. This provision reminds us that nurses have an ethical duty to elicit and communicate patients' values and beliefs. Engage in collective advocacy and leadership. Amplify voices that are typically silenced. Create shared understanding through the lens of nursing. But during COVID, nurses' voices were often ignored. We were called healthcare heroes, but that was just a title with a distraction from the rapidly shifting policies that disempowered us. Provision 9.2. Commitment to society. This provision goes even further, urging nurses to promote public well-being, challenge systemic injustices that compromise patient safety and access. During the pandemic, these ethical imperatives were often violated. Patients were denied treatments based on vaccination status. Alternative care options were restricted. Nurses were left powerless to intervene, even when they knew better options existed. The Navajo Nation. One of the hardest hit communities during COVID was the Navajo Nation, the country's top hotspot at one point. But many patients didn't die from COVID itself. They died from isolation policies, lack of basic necessities, disruption of cultural support systems. Provision 8.1. The system failed to collaborate with the Navajo Nation in a way that honored their culture, values, and needs. Provision 9.2. Nurses have a duty to challenge harmful systems, advocating for culturally competent care, pressing leadership for change, and speaking up for those most affected. Another critical area of nursing ethics that come into sharp focus during the pandemic: discrimination, moral courage, and allyship. Provision 1.1, respect for human dignity. This provision reminds us that nurses must challenge discrimination and bias, especially when those forces threaten equitable care or undermine fair treatment of our patients or our colleagues. New to the 2025 code, an important addition, and now for the first time, the 2025 code explicitly introduces allyship as an ethical responsibility. 5.2, moral courage. This provision reminds us that nurses are called to speak up, to demonstrate moral courage, even when doing so comes at personal cost. Advocating for a colleague under pressure, challenging discriminatory decisions, raising your voice when others stay silent. These are not acts of rebellion. They are acts of ethical integrity. Provision 8.3, emergency advocacy and public protection. During public health emergencies, nurses are ethically obligated to advocate for transparency, protect public health, ensure fair and proportional restrictions of individual rights, steward scarce resources. Provision 5.3 emphasizes our duty to maintain our personal integrity, even when it's uncomfortable or unpopular. Provision 6.3 reinforces that nurses are responsible for contributing to an environment that demands respectful interactions among colleagues, mutual peer support, and open identification of difficult issues that may have potential ethical implications. In this case, a COVID-positive patient requested their pastor to visit for spiritual support. However, because the pastor was unvaccinated, hospital policy denied the visit. The patient was elderly, scared, and feeling isolated. Spiritual support was crucial for their emotional well-being. Yet, the policy strictly prohibited unvaccinated visitors. No exception. Now here's the ethical tension. This patient's right to spiritual care, a core aspect of holistic health, was compromised. Their autonomy, emotional well-being, and right to self-determination. 1.1 states that all patients deserve respect for their inherent dignity and unique needs, including their cultural and spiritual beliefs. In this case, the pastor's spiritual support was an essential part of their care. Denying access to their pastor disrespected their unique emotional and cultural needs. Provision 2.1 reminds us that our duty is first and foremost to the patient in front of us. When hospital policy conflicts with what's best for the patient, we are ethically obligated to advocate for their needs. The nurse's commitment to the patient requires finding a solution that honors their right to spiritual care. Provision 8.1, the collaboration imperative emphasizes that patients have the right to comprehensive care that considers physical, mental, and spiritual well-being. Denying this patient access to their pastor violated that right. Provision 8.2, the nurse's role in mitigating health disparities and inequities.
Joining me for this module of Navigating Ethical Waters. I hope it challenged and inspired you to lead with boldness and ethical conviction. If you're ready to walk this road with other nurses committed to truth and integrity, visit righteousrn.com. And remember, standing for what's right isn't easy, but it's always worth it. See you in the next module.